Hi dear friend, how are you? How is day going with you? How was your day? I hope you had a very nice day today. Okay, I want to talk about some important question that you were asking me about. How sometimes you are feeling so bored, you are thinking that there is no motivation and there is no way to increase your business. We have many graduated midwives from different countries that they have very nice and competent skills of midwifery, but they are not happy with their individual midwifery practice. Yes or no? Actually, running individual midwifery practice need many very special skills. One of the important special skills is communication skills. The other important is that how to make a business more dynamic, because midwifery business is not only about just being as a scientist. It needs some other skills. For example, as a midwife, you have to be successful in some your private practice running needs. For example, if you be more successful in bookkeeping, billing, collections, taxes, accounts payable, it will help you move and control your financial system and keep it in place. So from the start, try to work on that. I know it is very boring job. Actually, bookkeeping job is very accurate and need too much concentration and focus. But if you want to start your business, if you try to make your foundation at the start with the correct way, you will get success in that. The second skill is very important. After these two skills, the third actually is dealing with insurance. Yeah, in some countries, you have some special insurance that they can cover your services. If you plan to accept some medical insurance, that there is a whole world of claims codes and coverage that you need to understand. And sometimes you will have some special insurance in your country for some special clients, or you will find some company and partners that they can provide a special insurance for some of your clients. You should be very smart, so alert. Go and find with some cooperative agreement deal with some of your outside of your clinic partners. For example, if you want to provide your clients some ultrasound or a scan, but in your country these outpatient services for midwife is not covering by insurance, you can try and find to make some cooperation agreement with some ultrasound office or with some others outdoor partners. For example, some services never cover in insurance. Like what? Like gymnasium, for example, like some dietitian services, or maybe you will find some other needs in your place of practice, for example, like pharmacy. So yeah, it's not, in some countries they will not cover by insurance. But as a midwife, as an individual business midwife, you can go and negotiate with these sectors, with these industries which are near your office and your place of practice. You can negotiate with them and try to get some cooperative rate from them. Then you can refer your client to that place and ask them to give them very interesting rate. So like this, you will get more client satisfaction, and your client will find it some special care and some special discount from you, from your services. There is many examples of that. In your own place, you will find different ones. It is very important you know how to do this negotiation skill and how to make this discussion happen with your outdoor partners. As you know, for example, as a midwife, we have different partners in our work, like surgeon, gynecologist, we have pharmacist, we have lab technician and lab reports groups, we have ultrasound and sonographer doctor. Plus, we are referring our client to different specialist doctors. So you have to know where you want to refer them, and before that, you start to have this negotiation and make this cooperative rate with them. The other important skill for midwife is online marketing. As you know, after Corona, we are more engaged and trying to jump in digitalization. In some developed countries that we are programming and making plan for them for their future midwifery or medical practice, they are trying to digitalize all of their medical services, from online visit, online telemedicine, or even online lab requests, ordering prescription and getting lab reports, plus even online antenatal classes, and so far. So you have to be very smart. Try to digitalize your services. How to do? First, start from digital marketing. Make your social media platform. Then make some chat rooms and website and online marketing. To do that, you will feel so overwhelming. It's important to learn how to stand on the overcrowded internet. Plus, it's very important for you how to be digitalized midwife to cover all of your services through online. Slowly through this social media marketing, you will get more clients and you can access to more services to provide to your clients. The other important things is client paperwork. I know we have different patients forms, practice forms, legal documents, and even informative handouts for clients. It's very important, but nowadays, because of this digitalization and this remote control, patient control, you can try to work on that and make all of them digitalized form and make documentation as a very lovely and digitalized platform. The other important things is that how to charting. You all know that the most efficient chart comes and forms vary from practice to practice, and charting challenges cases. So try to make it very innovative, plus try to make it to go through its own practice way. And one of the most important is communication skill. As I told you, professional communication. It doesn't mean, it means that is the variety of the situation you will engage with that maybe it's needed some written communication, or maybe it's as a verbal communication. You should know how to networking, how forming collaboration relationship, and even know how to write thank you for excellent supportive care letter and summarizing cases for consultant or referral. Because when you are sending letter for referral or consultation, you have to mention and you have to summarize all of the history of your client and write it in proper way as a formal, ethical, and very politely mannerism. And we reach to other skills for midwife, individual midwife practice is team management. As as my practice grows, it becomes increasingly necessary to have clarity about the roles of other members in our practice. Birth assistant or some administrative team members. Even we need some bookkeeper if we don't reach to that, if we can busy with many clients. We will need some travel and insurance exemptions as well as payment appeals. So don't forget, for all of this, we need some members, team members. Plus, we need some members that to clear protocols for things like handling emergency and maintaining certain skill sets. This is very important things that we have to think about that. Ninth option as an individual midwife we have to consider is supply management. What is that? It may seem very simple, actually for most of us. But not having the right supplies for a care visit or a birth can be real nonsense. Not to mention embarrassing, but it can happen for everybody. And sometimes when you are as an individual midwife, you have a home birth or water birth, or you want to have some home visit and checkup, you will need some of this supply to place in its own store. And you have to consider that for being a very successful midwife, you have to have a good skill in supply manage your supplies. And the last point, the important point is, how you can tell me, self-care. Yes, self-care. Please try and consider setting boundaries in your practice for your own personal health and self-care, because it's the best and important things and being more cautious about the best you can do for everyone in your life, family, client, and yourself. Sometimes when we will be more engaged with our business, with our patient, we forget ourselves. Good food, take care of our health, our beauty, our exercise, and staying happy with our friends and take care of our hobby and joy. Don't forget, they are very important and very essential skills for an individual midwife. Thank you so much for joining me for improving midwifery skills. I hope I can answer to some of your questions. I know it's not that much long description, but I will try to consider some of your question and query every alternative day in my life. Please write your comments. Please write your suggestion about this live, what you like to learn and what you like to hear from us for our next sessions. Thank you so much for love and support. If you liked our series, please don't forget to subscribe our YouTube channel, Lily Mom Center LMC. Press the bell and please share with your friends if you found it useful for yourself. We will have some online physiologic and optimal birth classes that will start from 4th June. We have a very interesting, knowledgeable speakers in our classes. So if you're interested, you can write your comments and we will try to help you to register. Thank you so much. Have a great day. Hey, adios. Bye. Ma salam. Khudafez. Thank you.